RSV continues its unprecedented surge. Major children's health groups, including the American Academy of Pediatrics, are calling on the Biden administration to declare this respiratory virus a health emergency. So joining us now to talk to us about this is Dr. Susanna Hill. She's an assistant professor at Columbia University College of Physicians and Surgeons. She also specializes, as I understand it, in pediatric airway infections. So you're the perfect person to talk to us about that. Thank you. I appreciate you being here tonight.
Of course.
So first, let's talk about this surge and the fact that there is talk of it being declared an emergency, a public health emergency. What would that do, not only for the hospitals, but really for the patients?
Well, really what that would mean is increased flexibility to reallocate resources to free up hospital beds and allow hospitals to share, so hospitals that are overwhelmed can transfer patients more easily to places that have beds available. It allows providers like me to care for patients remotely with telemedicine, sometimes across state lines. So it's really a matter of freeing up resources and allowing more ready access between healthcare systems.
As a parent, you're always told if you have a newborn, steer clear of RSV, be careful of RSV. But it seems it's not just newborns now, it's kids, and I'm even hearing of elderly individuals who are also getting affected and hospitalized because of this. Why is it so dangerous?
So it really causes a tremendous amount of injury and inflammation to the airways and to the lungs. With infants, the airway is really small. If there's a lot of inflammation and swelling, there can be trouble breathing because the airway gets that much smaller. It can cause lung damage to an airway injury in anyone. So we're seeing it in older kids more and more this year than we were in the previous years because they may be getting RSV for the first time. We've been preventing spread of viruses for the last couple years with all the protective measures with COVID. Now, older people, older kids are getting it where they may not have if they had their immune response boosted up from getting exposed last year, the year before.
Have you seen anything like this in your career, or is this as unprecedented for you as we're hearing it is for others?
Well, the volume is certainly new to everybody, I think. This is an unprecedented volume. Seeing 18 states have 80% or more of their pediatric hospital beds full right now, that's unusual. But we always do sort of see a triple-demic in the beginning of the school year because viruses are being circulated among kids. So in the sense that it's not uncommon to see influenza and RSV and multiple viruses circulating, this volume and this sort of intense crunch in the pediatric hospitals is concerning.
So we know that there's something to the immunity of flu, right? If you usually don't get it twice a season, hopefully not. We know that with different variants, there could be some immunity with COVID. What about immunity with RSV?
Yeah, so with any virus, you can get it more than once, but you may not get as sick. You probably won't get as sick the second time. So whereas you may be sick in bed with RSV or even hospitalized the first time around, it's less likely you'd have such a severe case if you got it the same season another time.
Okay, and unfortunately, no vaccine, which we need.
Right.
Can we get that going?
Well, so that would be the hope, right? You can see with what happened with COVID, vaccines for viruses very quickly when they have the support are possible. So is that possible? Yes. Do I wish we had it? Yes, because every year in my specialty, we see infants who are in severe respiratory distress because of RSV. We see lots of kids hospitalized because of RSV, and it can be really scary. So we would love to have a vaccine. Is it possible? Yes. So we're waiting and hoping.
It seems like a lot of people are just really focused on this, especially in advance of the holidays. I mean, I'm wondering, do I take my kids out? Am I around other family members? How do we sort of navigate this?
Yeah, well, the same holds true this year as it did in COVID in the sense that the protective measures work against any virus. Each family will make its own decisions, but washing hands will work for any virus. It's really helpful and very important. Masking for people who are immunocompromised or if there's particular concern can be really effective in preventing spread. There are two things I would highlight as particularly important this season. If you're sick, if your family member is sick, then protect everybody around you by avoiding those gatherings, especially where you're sharing and eating food.
Stay home.
Stay home. And also, I would just urge everybody to consider if they haven't gotten the flu vaccine or they haven't gotten COVID vaccine or the booster, think about that because that will be an effective way to keep from getting really sick, and it'll prevent people around you from getting sick from you.
Good advice there. Dr. Hills, thank you. We appreciate your time tonight.
You're welcome.